Hello, this is Dr. Amr Khalil. I'm plastic surgery consultant in the UK. I'm going to talk to you today about a facelift procedure and mainly the plain facelift. Would like to do some introduction about the facelift and different types of facelift and what is done during facelift procedure. And then we'll discuss later the novel technique. It's not so novel actually, but it is the most recent advance in facelift, which is a deep fill plane facelift, and what is its advantages and what is the recovery time for it and all other information. So first, facelift is a procedure which involves many, maybe surgical or non-surgical, that are used to rejuvenate the face or to restore youthful and fresher appearance of the face. So in facelift, usually we deal with the mid face and lower face and the neck in that procedure. In general, procedures would include non-surgical procedures like using Botox or fillers at the jawline or threads. These procedures are good but has got its own indications for a certain cohort of patients who are mostly young adults, don't have much laxity of skin, and the results are usually temporary results and you need to do them every 6 months or a year, which would be somehow costly more than the surgeries. The surgical facelift involves surgery with incisions at the hairline and in front of the ear and at the back of the ear and posterior hairline, so that these incisions would be hidden in these areas. It is like 2.5 to 3 hours procedure, day case. If you do it, you will be discharged at the same day. Recovery usually takes about 3 weeks. You can return to work within 2 to 3 weeks, and results are usually much more durable and much better than the non-surgical procedures. So there are different types of facelift. To discuss the different types of facelift, you need to get an idea about the different layers of the face. So the face, first thing we deal with is the facial skin and subcutaneous fat, which is the fat just underneath the skin, and a deep layer underneath the fat, which is called the SMAS, or superficial musculoaponeurotic system, which is a layer of fibrous tissue which has got some fat over its top and is continuous downward with a muscle in the neck. It's called the platysma muscle, which is the muscle you will men know quite well. When they shave, they tighten their neck through contracting this muscle. And then below this mass layer, there is the muscles of the face, with the facial nerve supplying them from the bottom, except a couple of muscles. They are just beyond the talk here today. So in doing facelift, the procedure which has been done like 40 years back was just skin only facelift, where the surgeon will just dissect underneath the skin within the subcutaneous tissue and then take the excess skin and close the wounds. This technique is almost obsolete. However, I think some surgeons still do it. It is a safe and quick technique. However, results are definitely suboptimal because you don't address the deeper tissues of the face, which was found that it plays a very big role in facial droopiness, mainly the jowl areas and the jaw lines and in the neck, together with the neck muscles and the platysma, which will form the medial neck bands. and obliteration of cervicomental angle, which is the angle between the mandible and the neck. So after discovery of these of the role of the deep tissues like the SMAS, different techniques has been evolved, like SMAS plication. So the surgeon will tighten the SMAS layer with sutures, which may be very slowly absorbed sutures or permanent sutures. And another technique, which is cutting off a part of this deep layer and then restitching the edges of the cut edges of the SMAS layer. And then comes a technique where they do SMAS flap. So they take the SMAS as a flap, or extended SMAS flap, like as a flap, and stitch it up into the deeper structures in order to lift the jowls and lift the nasolabial areas and to lift the mid-face and to lift the neck. There's extended SMAS flap. Both the SMAS flaps and extended SMAS flap do very similar to deep plane facelift, where you do the undermining or the dissection under the skin, and at a certain level you cut the SMAS and go underneath it, and then stitch this edge of SMAS into the deeper tissues and cut the excess skin. So our talk today will be as SMAS for SMAS flaps and for deep plane, and I would prefer to put both in one category because both give the same result, and they involve cutting of the SMAS tissue and going very carefully above the muscles in a layer above the muscle to cut all the ligaments which hold this SMAS layer or the deep layer of the face, and then start to hang up this layer with sutures upward, so that this will give a pull up for the jowls and backward for the neck. The best advantage of this technique is that it is durable, so it may stay for 10 years or more. People use usually non-absorbable sutures. I personally used slowly absorbable sutures, which take about 6 months. We call them PDS sutures. And by that time of 6 months, fibrous tissue would be formed instead of these sutures to keep this SMAS layer in place. Second advantage of this technique is that it gives very natural results, because it addresses exactly the layers that sag with time and with age. So you don't get this windswept appearance of the very old techniques of skin-only facelift, and it just hangs the deep tissues together with tightening of the skin and flat straightening of the rhytids or the wrinkles to a great extent. Third thing is that the recovery is good. You get a good blood supply to the skin flaps because you go into a deeper layer, so you take more blood vessels with you in your flap, so you have better wound healing. Recovery is very good, and results are really fantastic results. So before you go to your doctor and ask for a facelift, you should ask what technique is done. Is it just skin only facelift, which is the very old technique, which you will need to just repeat the surgery in a year or two because you don't address the deeper SMAS layer? Or is it just SMAS plication or SMASectomy, which is SMAS excision, or deep plane or SMAS flap, which is the best used technique and more durable with fantastic results? So you have to know quite well what technique of facelift you are going to do and what is the best technique, And what's the advantage and disadvantage of this deep layer? I would personally recommend the deep plane facelift with its fantastic results, which if you just want to do a facelift, you'd rather go for a deep plane facelift. Thank you so much.